One of the things that we know from student life is that when a student is engaged in the campus community, the student is more likely to retain and graduate. And one of the best ways to keep a student engaged in the campus community is to keep them healthy, not only physically but also mentally. And so what we thought was really important was how can we support our students through additional counseling and medical care to keep them healthy and keep them engaged in our campus community. TimelyMD has come alongside our marketing program. Our marketing team at ACU provided additional resources that help drive utilization to a higher degree and create a broader awareness of the program on our campus. So several of the things that we've really tried hard to do at ACU to help us support our students better and to have stronger retention and graduation rates really started from the beginning with enrollment management. And one of the things that we realized was that our admissions model and our financial aid model were not in alignment with each other. And so one of the first things that we did was we tried to align our financial aid model to our admissions model. The second thing that we did was we centralized our academic advising. And so by centralizing the advising, we were able to provide a more consistent experience for our students. One of the other things that we implemented was TimelyMD, what we call here at Abilene Christian University, we call it Wildcat Care. Some of the success we saw from the initiatives that we took place is we've seen about a 2.5% lift in our retention rates, and that's carrying through so far through the sophomore year and to the junior year as well. So for an institution like us, that's retaining an additional 25 students a year. Not only is that 25 students that are potentially still here that wouldn't have been here who are experiencing ACU, but that also helps lift our national profile. When we look at, again, things like TimelyMD, who can help us with that mental health crisis, the more resources we have to be able to provide to our students to support them, not only from an ongoing basis, but sometimes we need counseling services and an immediate need that students in crisis at that moment, and having 24/7 access to that is a significant impact to our institution. And the fact that was included in the base price of tuition already, there was no additional charge for students to get this care. From a public health perspective, we need our students to be healthy when they're living in residence halls, and when they do become ill, we need them to get the care they need soon. But the other thing it enabled us to do is whenever our clinic was actually backlogged, we may be in flu season, and we have a lot of students who are trying to go get a provider to get access that day. We're able to actually refer people to TimelyMD, and so that way we can see more patients in a given day, and we don't have students that are sitting there in their residence hall waiting a day or two to get into a doctor. And parents feel very confident in sending their children to ACU because they know that we care deeply about the health and well-being of their children. At ACU, we actually call it Wildcat Care. Our students don't necessarily know what TimelyMD is. What they know is what Wildcat Care is, because we created a continuity of care that merges the online telehealth component with the physical face-to-face care that we provide within our clinic. And we worked really hard to create a seamless experience for our students, and so it was very important to us to continue to have a program like TimelyMD that could provide additional counseling and support to our students as they transition, because these are unique times, and we're trying to walk alongside our students the best we can, but we also know we need other people to help provide that care and support to them.